Chai with Manju, with your host, Dr. Manju Sheth.
Hello and welcome to special edition of Chai with Manju called Trailblazers, where we showcase those individuals who've carved their own path to make their unique dreams a reality. One such person is Dr. Reshma Kewalramani. She's the first woman president and CEO of a large US-based biotech company called Vertex Pharmaceuticals. They believe in using biotechnology to create transformative medicine. It's a large company with over 3,000 employees across the world, 70 billion in assets, as well as lot of focus on inclusion and diversity. Let's meet Reshma. Reshma, hello and welcome to the show. It's such an honor to have you with us today.
Manju, thank you so much for the invitation. I'm delighted to be here.
You made history as the first woman to lead a large US-based biotech company. There is a lot of hard work and preparation that goes behind it. So let's start at the beginning of your journey. You were 11 years old when you left Mumbai to come to Chicago and then to Long Island. What were some of those lessons in the early years that led you to the leader that you are today?
You know, Manju, when you say it like that, it sounds so different than I recall my own life. You're right. We
Mhm.
left Mumbai when it was still called Bombay. I was 11 years old. And we really came for the American dream. My parents wanted a better education for us. My father wanted to try his hand at business in the US. And so our family of four packed up and we came to the US and we made our first stop in Chicago because that's where my aunt lived and that's who we were
Mhm.
going to live with for the time being. We then moved to New York, and that's where I went to school. Elementary school, sixth grade is the grade I started in, and then all the way up through high school. And I'll tell you, while I was so happy to be here, at that time, this was the 1980s, early 1980s, America was described as the land paved with gold. We didn't have the internet. We didn't have a lot of access to what the West was really like. And so I came with these real expectations, and it was all that. It was such a fun time. Um, the buildings, the roadways, the school system. I was pretty gobsmacked by it all, but it was also hard. I was 11 years old. I didn't really understand pop culture. I didn't dress like people here. And while I spoke English, nobody knew I was speaking English because I was so heavily accented. And
Mhm.
that was hard. And it does teach you some life lessons that stay with you. I would say resilience is one of them. Self
Mhm.
reliance is another one. But certainly also gratitude and learning how to adapt and make a world for yourselves that's very different than the world you came from. And I think above all, such acknowledgement for the opportunity that was available here and this idea of not squandering it, but doing something good for the society that you've come into and for your family, that just stays with you forever.
You've had great education in our beautiful city of Boston, 7 years med program at BU, residency at Mass General, combined nephrology program at Mass General and Brigham, followed by general management course at Harvard Business School. And then you changed course to go to California to join Amgen. Thankfully, you came back to Vertex in 2017 and became the CEO in 2020. What was that moment like when you knew that you will be leading this great biotech company? How did that make you feel?
You know, Manju, it actually wasn't a moment. It was a
Mhm.
process.
Yes,
Um,
yes.
and there was a full process. There was an internal search, there was an external search, and It took time.
Mhm.
And that process actually gives you a lot of opportunity to reflect and imagine. And
Mhm.
honestly, what I thought I would do with my life is be a doctor, as you are.
Right.
And while I always knew that I wouldn't be the kind of physician that worked only with patients, research was always really a passion of mine. I actually thought I'd work in a hospital. I'd run my lab. I would see patients half a day a week, and I
Mhm.
would teach. That's what I really thought. And so as this process was moving forward, really what I was thinking about is, boy, how life takes you in different directions than you even planned for yourself. That's
Yes.
one thought I had. And
Mm.
another thought I had is how important it is for you to be open to these kinds of serendipitous opportunities. We went to California when our kids were 6 months old. My husband was gainfully employed here in Boston. I was working at the Mass General and the Brigham. We love everything about the city, and we would have never left, except we did. We took this hard left turn and went to California, and then California became our home. It's warm, it's sunny. We lived in this beautiful town. I tell people the story about buying our forever house before we left. And
Mhm.
I only lived in that house for 9 months, and so you have a lot of time to think about these turns you've
Right.
taken. Um, but at the end of the day, I really felt a lot of gratitude, a ton of humility, and a real responsibility to discharge this responsibility in a very very serious way, not only for the company and for patients, but also for the women who see this as something that is really important, because you have to be able to see people who look like you in leadership positions in
Absolutely.
order to know
Absolutely.
that it's absolutely possible.
I remember as a young physician in England, I worked in a pulmonary ward with a lot of cystic fibrosis patients. There was a lot of hopelessness in those days. Your company, Vertex Pharmaceutical, has brought hope to cystic fibrosis patients all over the world. You're also doing great work with thalassemia, sickle cell anemia, and many more diseases. Tell me, what do you think has been the greatest achievements of Vertex so far?
I really appreciate that question. And it doesn't surprise me that as a young physician in England, you saw a lot of cystic fibrosis
Yes.
patients. Cystic fibrosis is a genetic disease. It also has a founder effect, which is to say it's most prevalent in northern Western Europe. And there's a high prevalence in England and Ireland. And you're so right about the sense of hopelessness. That is the worst thing in the world, to not know that there is something that could help you. And I would say by far and away the most impressive, the thing I'm most proud of for what Vertex as a company has done is transform this disease, cystic fibrosis.
Yes.
And I feel that way because it is not only a genetic disease, but it's a disease that impacts kids, babies. And one of the wonderful things about Vertex is it has extended its drug development all the way down into the pediatric population. And we have approvals for babies as young as 4 months old. And you could just imagine how hard it is to do clinical trials in a 4-month-old baby, both on the side of the parents who trust us to do this, but also on the side of the physicians and scientists in the company who do this kind of work. And that transformation has been just absolutely um, uh, an extremely proud moment for the entire company.
Yes.
But it is not something that happened overnight. It is something that the company's been working on for 20 plus years. And my predecessor, Jeff Leiden, really made transforming cystic fibrosis a priority, and he gets a whole lot of credit along with the scientists. I will also say, Manju, though, I am so looking forward to doing the same exact thing that we did in cystic fibrosis, in beta thalassemia and sickle cell disease and AATD and FSGS. And I happen to be a kidney doctor by training and background. So that holds special importance to me.
So that brings me to the next question. What is your big vision for Vertex?
I've had a chance to think about this long and hard, because we made the announcement of the CEO transition almost a full year before we actually did the transition.
Yes.
And I would say, quite simply, what we did in cystic fibrosis transform this disease, give hope, and let people live a full and healthy life.
Yes.
That is what I would like to see Vertex do 1, 2, 3, many more times in the other diseases in which we are working. And I'm looking forward to doing that.
It's exciting. What does leadership mean to you?
It's certainly the components that you would imagine: setting the strategy, showing people the vision, appropriating your resources. It is that. But the most important thing to me is developing and setting up future leaders. That is what I think leadership really comes down to at the end of the day.
That's so true. So one of the things that really excited me about Vertex when I heard from you that 53% women, 42% in high positions, and 1/3 of the employees are racially and ethnically diverse. That is just simply amazing. How do you manage that?
I'm impressed with your research, Manju. That all of that is absolutely true. I'll add one more. 50% of our board is either racially or gender diverse. So it's really top down and bottom up.
Yes.
All credit to the culture of Vertex, all credit to the executive committee at Vertex, and lots of credit to my predecessor who made this a priority. These are not things that, just like a pipeline doesn't develop overnight. It takes a decade to 15 years to bring a medicine from bench to patients. It takes a long time for you to develop a culture, a mindset, and a company that is diverse and inclusive and equitable. And this work has started in 2012. I'll tell you a few things that excite me. We're very deliberate about this. So we review our population, our employees, as an executive committee quarterly. We are very serious about STEM and STEAM education in the community.
Yes.
And we bring kids in, little kids, elementary school kids, all the way up through high school. And we have programs for the Boston Public School in our own buildings, in our own laboratories. And we're also very engaged with the community in terms of thinking about where talent is and going there and ensuring that they understand that Vertex is the kind of company that values them and wants you to be a part of us.
Absolutely. Now, and also it's so important to encourage more and more women in the STEM scheme program as well, which you are doing. Right?
So true. Encouragement and mentorship are fundamental to bringing more women and diversity in general into STEM. And I feel very strongly about mentorship. And I think this idea of being a beacon of possibility, a company like Vertex can do that. And I'm very proud to stand behind it.
So exciting. Tell me, how has the company been affected, and you personally, in these tough COVID pandemic times?
Yeah, what a great question. The pandemic is something that is unique in that each and every one of us around the globe, governments, businesses, individuals, none of us are immune to this. And I don't think we've gone through something like this together as a
Right.
global
No,
community, not in my lifetime.
no, no.
Um, and it has certainly affected us in very obvious ways. For example, we're not sitting together, we're Zooming with
Right,
each other.
right, right.
Our company decided early on, quite early, that this is something that we wanted to take very seriously. And we had our employees work from home very early. We canceled travel, we canceled certain large gatherings, and that served us very well. Now we are almost in a new way of working. Our lab scientists come in for sure, and our manufacturing teams come in, and we have some amount of our staff in the offices who are using the offices, but many people are working from home. My kids are studying from home, so we are using our internet fully. I have twin boys. Both of them are in hybrid learning. My husband is working remotely, so we've all staked out different parts of the house, put our laptops down, and staked out our place.
I have heard that your offices are so beautiful.
Our lab for our kids, our Boston Public School kids, and the kids who come in for our STEM and STEAM program, they're up there on the ninth floor, and it is
Right.
such a warm and encouraging place. It makes you feel like doing science.
And Seaport.
Yes, yes,
So I have to ask you a fun question. Okay.
sure.
You were kind of studious always, which is not surprising. But your husband was a great guitar player and you used to come and watch. So what does Reshma do for fun?
My husband's a great guitarist. He's also a singer. I am neither. I'm actually horrible at any musical instrument. Um, I like to travel. I love food.
Mhm.
And I'm a snowboarder, which surprises people, but I am.
Okay. Okay. And I heard a very interesting story about seven wonders of the world, and one is remaining. So tell us about that.
Wow. Yeah, yeah. As I said, I like to travel. It was about the seven new wonders of the world, and I thought, well, wouldn't this be great if we did all seven wonders of the world before the kids went to college? And I was a geek. I probably still am, and I love making lists, and I methodically go through my list and check it off. So I put the seven wonders of the world on the list. We've done six, but you're right. We were going to do Brazil and Christ the Redeemer this year, but COVID put a kibosh on that. So we are waiting to do that one in the coming years.
Next year, something to look forward to.
Exactly right.
We wish you all the best and great luck and good wishes.
Manju, I've had so much fun being here with you. You are a trailblazer in doing
Oh, thank
this
you.
work, and it's very, very nice to finally meet you in person.
Thank you. Thank you.